Back with you again. My name is Roger McGee. I'm your paramedic instructor. Today I will demonstrate to you how to care for an injured ankle with an ankle splint. The importance of an ankle splint is because this skill will help you to become a competent EMT for the state of Tennessee. It's very important that you're able to perform this skill, not only watching what I'm doing, but able to perform this skill for a proctor when you test for your license. The reason why I am here for you today, because me being a paramedic instructor, I have history in this field as far as 9 years experience, and I've performed this skill numerous times. Today we're going to begin by showing you my equipment. I have gloves that I will use today. Also showing you 3 triangular bandages that we will use. Also 2 blankets. Okay? You can use pillows if you have those. I want to start by making sure that when you arrive on the scene of a call, for any call, you want to make sure that your scene is safe. Scene safe meaning that if the person was assaulted by someone, making sure that person is not on the scene at the present time. If they are, you need to call for police, wait for police to clear the scene, then you're able to proceed on the call. Next, when I am able to approach my patient, I kneel to my patient. I want to talk to my patient to interview. Hey sir, what's going on? What happened today? I want to make sure that my patient is alert and oriented, that he has a patent airway. That means his airway is open, air is going in and out. I want to look at him to make sure he's breathing, good chest rise and fall. I also want to make sure I do a quick body scan to make sure that he is not bleeding or have any obvious bleeding or deformity. The importance of this is you don't want to care for an ankle and you have a patient that's possibly about to die. Next thing I want to do after I interview my patient, I want to go to the injury site. The injury site is going to be his left ankle. The first thing I want to do is expose the injury site. So notice that he has clothing on. I will take his sock off. I want to be very gentle as possible. You may cause some pain to the patient, but you want to be as gentle as possible. As soon as I expose the site, I want to see exactly what I'm dealing with. How bad is the ankle sprain, or if there's any bones or anything sticking out. So I want to first assess his pulse, make sure he does have a pulse. Ask him, sir, can you feel me touching your foot?
Yes.
He can feel me touching his foot. Are you able to wiggle your toes? He is able to wiggle his toes. He's able to follow motor senses, so that's good. Next, I'm going to take this blanket. Take this blanket, place it under his foot, being as gentle as possible. Place it under his foot. I'm also going to take these 3 triangular bandages, place them under the blanket. Once I take these bandages, place them under the blanket, I take the blanket, roll around his foot and ankle to secure the blanket around his ankle. I want to make sure that I leave his toes exposed. That way I can always see the nail bed to make sure that I am able to assess his circulation. I'm going to tie these bandages from top to bottom. All 3 bandages, top to bottom. Once I do that, secure. And the point of this blanket is to pad the injury to make sure that it's providing comfort for him. I'm going to recheck his pulse. Make sure he still has pulse. Yes, he does. The next thing I want to do is take the other blanket, fold it. I'm going to elevate this extremity 8 to 10 inches. The point of me elevating causes the blood to go from the injury site, will cause less pain, and I want to prevent the swelling. In conclusion, what I will do is have you perform this skill on your own. I want to make sure that you are able, that you feel confident, and also make sure that you understand the steps of this skill, and to make sure that you are able to perform this, again, with comfort and that you feel confident. That concludes my skill for today.